Welcome to the third episode of our medical series, Intervention for Medical Emergencies. On this episode, we are going to be talking about syncope, what we know as fainting. Now, what happens when someone faints? Now, when someone faints, it's as a result of lack of blood distribution to all parts of the body, especially the brain. Now, this lack of blood distribution to the brain causes less oxygenation in the brain, and this is actually what results to fainting. Now, when someone faints, what you are trying to achieve is to ensure even blood distribution across all parts of the body. Now, the first thing you should do, the first intervention that you should take is to lie the person flat on their back. Do not lie them sideways. Do not make them sit. Do not hold the person down. Just lie them flat on their back. Now, what does this help? When someone is lying flat on the back, it allows even distribution of blood to all parts of the body. And this is actually what you are trying to achieve. This is the first step that you should take, or the first intervention you should offer when someone around you faints. Two is when, as they are lying flat on their back, elevate the leg. That is, look for something, probably a pillow or anything, a stone, depending on where the person is. Make sure that the leg is above the head. So you raise the leg while the head is down. What does this help to do? Your leg raised and your head down actually helps to increase venous return. Now, what is venous return? The backflow of blood back to the heart. This actually ensures distribution of blood to the brain and increases oxygenation. Remember, here we are concerned about oxygenation of the brain. So ensure that after laying them flat on their back, elevate the leg with any object around and to ensure backflow of blood to the brain. Now, the third intervention that you should offer is to make sure that all tight clothing are loosened. Now, when someone is putting on tight clothing, especially around the chest region, the ribs, this helps to constrict the blood vessels. Now, constriction of the blood vessels prevents or restricts even distribution of blood along the blood vessels. So once the tight clothing are removed, this helps to relax the blood vessels and ensure that blood flow is easy. Make sure that the environment is also not congested, not stuffy. You know, when people faint, people try to gather. Instead of trying to make sure that this person is getting enough air, making sure that this person is free, they try to gather around and make the environment congested. No, do not do that. Now, the fourth medical intervention that you should offer is to check for pulse and breathing. Now, checking for pulse and breathing helps you to distinguish between fainting and other more serious medical emergencies like cardiac arrest. Now, when you observe that there is no breathing or there is no pulse, quickly rush the person to the nearest hospital or nearest emergency center, because that is actually a more serious medical emergency than what you suspect. Now, the last medical intervention that you should offer to someone that faints is to avoid giving them food or drink immediately. You know, some people, when someone is fainting, you are trying to force things in their mouth, force spoon in their mouth. No, do not try that. Giving food or drink to someone that faints immediately is a wrong practice, because actually at that point the person still have impaired swallowing reflexes. So forcing food or anything in their mouth can actually help to cause choking, aspiration, or even more harms or damages than you can actually imagine. So just make sure that you lie them flat on their back. Make sure that the leg is elevated. Ensure that all tight clothing are loosened and the environment is not congested. Make sure you check for breathing and pulse. And finally, make sure you don't force things on their mouth. Thank you for watching. I remain your favorite pharmacist, Dr. Best. Follow us on all social media platforms at Dr. Best, and make sure to like, comment, and share our videos to all friends and family, because someone might just be your savior one day. Bye-bye.